Thinking of traveling abroad for having a hair transplant procedure? Watch this short video first. Every week, I meet patients in clinic who are considering traveling abroad for a hair transplant procedure. Some ask whether this is a good idea. They ask my opinion. Others come to see me after they've already had surgery elsewhere. This isn't a video today about one country in particular or certain clinics or any one clinic. I am sure excellent surgeons exist all over the world, and there are good clinics and responsible clinics all over the world. But equally, poor results can happen, let's say, everywhere, anywhere, and they do happen every time. The important question isn't where your surgery takes place. It's how you choose your surgeon, the clinic, how well you're looked after before, during, after, and long after the procedure. Here's the questions I believe every patient should ask before booking a procedure abroad. 1. Do your research. Start by looking beyond social media. All over the internet there are beautiful before and after photographs which seem encouraging, but they only tell part of the story. Ask yourself, who will actually perform my surgery? What are those surgeons' qualifications? What is their experience, if you can find that out? Can I see results from different angles? Do they have 12, 18, 20 months follow-up photos? Are there patients with hair loss patterns, cases similar to mine? Are there independent reviews, not just testimonials on the clinic websites and maybe even on certain review websites? The more information you gather, the better decision you are likely to make. Second, who will look after you? A hair transplant isn't just a single day spent in the operating theater. It starts with a consultation, with an informed decision making, and it will continue throughout your recovery journey. Ask, who will meet me and examine me before the surgery? Will I meet my surgeon beforehand? Who performs each stage of the procedure? Who do I contact if I have concerns after I return home? Knowing exactly who's responsible for your care will provide a degree of reassurance and clarity. Think about the follow-up care. Recovery doesn't end when you fly home, when your flight home takes off. I've heard this recently from a couple of consults. Hair restoration is a journey that unfolds over many months. Questions can arise during this phase regarding healing, let's say redness, shedding, medication, or progress. Consider how follow-up appointments will work. Will the follow-up appointment be virtual? This is very likely. Will you need to travel again? Most certainly, if any corrective procedure will need to be performed. If something unexpected happens, who will be the person reviewing you? Good follow-up care is also part of this treatment plan, and it should not be an optional extra. Fourth point, what if you need revision surgery? No surgeon wants a patient to require having a revision procedure, but every surgical treatment carries that element of uncertainty, and that's just the reality of life. So it's sensible to ask, what happens if the result isn't quite as expected? What if further surgery will need to be recommended and performed? Who will assess me then? What support will I receive? Planning for unlikely situations doesn't mean that you are pessimistic. It's just simply being well informed. Fifth point, managing your expectations. Hair transplantation and as well I would say all of the cosmetic procedures can produce life-changing results, for the better or for the worse. But surgery has its limitations. No surgeon can create unlimited density. No donor area is infinite. No procedure can stop future hair loss on its own. Be cautious of promises that sound too good to be true. A trustworthy consultation process should include not only the potential benefits and the positive aspects, but also the limitations and the risks. Realistic expectations are one of the strongest predictors of patient satisfaction. Sixth point, I would say, the questions every patient should ask. Before booking in for surgery anywhere in the world, Make sure that you know the answers to these questions. Will the surgeon personally examine me, consult me before the surgery? Who performs each stage of the procedure? Am I genuinely a suitable candidate? What are the risks and possible complications? How is my donor area being protected? This is very important. What happens if I continue to lose hair? What follow-up care is included? If I need help after returning home, who will I contact? Who will answer the phone, the email, and so on? Can I see mature results at 12, 18 months? What is the long-term plan for my hair? If those questions can't be clearly answered, then take your time, take more time before making an informed decision. Traveling abroad for surgery isn't automatically the right choice or the wrong choice. The quality of the decision will depend on the quality of the information you receive in the first place. Choose a surgeon, a clinic, not a destination, not a price. Choose a long-term treatment plan, not just the procedure itself. And remember that the best consultation should leave you feeling well informed and never pressured, because a hair transplant is more than a day's surgery. It's a decision that you'll live with for many years to come.